you need?
No, you gave me everything I think I need.
All right, so my response to Manuel on his Obamacare or the Affordable Health Care Act is worth the money that will be needed to fund the program, will reduce the overall costs of the healthcare programs by keeping those Americans or people healthy. And I'm here to say, no, it's not. His two secondary claims are the Affordable Health Care Act is worth investing money into. His second secondary claims is overall health of the U.S. citizen will help improve and lower health care costs overall. And my response to the first one, which is the affordable health care is worth investing money into, and he tries to establish a quote from the ObamacareFacts.com stating that the average American will pay anywhere between 3 to 9.5% of their actual income, and that income will go towards actually helping you guys or the people that can't afford or don't have health care. Now, this sounds and looks all good, but in reality, according to Alex, can't pronounce his last name, I'm going to try anyway, Newsman states in his article, Obamacare raises Medicaid costs as insurance shift to the tax bill. He states here, states will actually pay 13.3, anywhere from 13.9 billion dollars per year, and as a result from this, the actual person or the individual with that's contributing to this will actually see an increase of 1.6% each year starting 2015. 1.5% increase from the 3 or towards the 9.5% from that's already there. It's kind of a lot, and that's cumulative every single year. And further on, the advocate or Manuel tries to reason by saying that the healthcare is actually affordable and can be obtained in some cases through Medicaid without paying a single dime, but fails to mention the actual prerequisites for being eligible for Medicaid. According to the main website of Medicaid.org, it states that if you, for example, you need to have a family of, let's say, 4, here that anywhere from $20,000 income or lower in order to be eligible or to fit the criteria of Medicaid. Now that's kind of, that should have been mentioned there in order to be able to see Medicaid as an eligible thing to do. He further on states, the advocate further on states, by 2023, the Obamacare will potentially have saved tens of thousands of billions of dollars for Medicare costs overall. Unfortunately, this is incorrect and will cost taxpayers even more money, according to the same person, Alex Newsman, from his article of Obamacare raises Medicaid costs for insurance. He states the tax is actually based on a company's U.S. market share. It's also expected to raise premiums by as much as 2.5% from the employers or individuals who buy their own insurance. And this is actually going to raise anywhere from $350 to $400 per year on the average family, which is anywhere from the middle class. Going down to his secondary claim, which is overall health of the U.S. citizens will improve or lower costs. The first point he tries to make is overall costs for the other programs and procedures will lower in cost, but he actually does not show any evidence or fails to present that the small hospitals will potentially merge into larger hospitals, and this isn't going to potentially increase fees for any one of us. Going with, and even just to back this up, Amanda Gleger states on her article from the CNN Money how Obamacare affects your bottom line. She states, Small practices are price takers, but large groups and hospitals are price setters. She further on goes by saying that the health insurer, one of the health insurers, Singa, has seen bills from practical cardio procedures jump from 300% to 500%. Now that doesn't help any of the healthcare program costs at all. And again, the advocate tries to reason by stating examples of how keeping people healthier and will reduce the actual visits to the hospital, but fails to mention the increase in additional fees per visit. Again, Amanda Glanger, from her article, How Obamacare Affects the Bottom Line, from the CNN Money, she states that she has also seen that for something phrased as facility fees going into regular people's bills jump from 75 to 150 per routine office visits. So these are just the plain old routine visits. Now, in my speech, just to conclude, I responded to the Affordable Health Care Act is not worth investing money into, which was the first point. The second point, overall health of the U.S. citizens will not lower the health costs through these points right here and this evidence that my manual has failed to represent. Thank you.
All right, the main proposition on the Affordable Care Act is labeled. You've got a general counterclaim that you're going to be arguing. The secondary issues, I think, are also labeled pretty clearly. On the first point, you start and you present a series of statistical information, a 3 to 9% increase. There were some other numbers there. I don't think those numbers were explained very clearly. And then you've got a quote from somebody. You had a little bit of trouble with Alexis's last name, Newsom or Newman or whatever it happened to be. We've got the total cost per state's $13.9 billion. That's fine. And then you say it's 1.6 each year. Now, is that a percentage? Is that a dollar amount per person? Is that per state? And the problem with this argument is that there's no comparative data. So, for instance, if we're having an annual increase of 1.6% each year, that sounds like it's high unless our current average annual increase is 8% each year, in which case the Affordable Care Act has got a substantial advantage over existing price structures. I don't know because there's not any comparative information in this argument. So the data without a context doesn't help us very much. Then you talk about the Medicaid issue and how that's supposed to reduce costs, and you suggest that people really aren't going to be able to qualify for Medicaid, and I think that that's a reasonable argument to make. I think, though, that you need to show that that's going to be a substantial portion of the population that's not going to be able to meet this minimum qualifications, and therefore they're not going to get any particular savings. And then you've got another piece of evidence from the same source that, again, has some statistical information on it. You mentioned a $350 to $400 a year increase for I assume that's for the average family. That's at least quantified, and then we know that I assume that that's over and above what we've got here. So that's a pretty good argument. What I think you need to do is contrast it a little bit more to the evidence that the advocate presented. They've got these fact sheets that they claim talked about savings. Well, what's the basis for that information? Why is your information more useful? Because it's based on real experience so far, or is it because there's some metric or some study that's been done that gives us this data and makes it a more valid comparison than the inference or the standard that was used by the Obamacare fact sheet page? I don't know. So we're not getting that kind of contrast on that might be helpful there. On the issue of overall health costs, you do have a challenge to the advocate's argument on what evidence that they provided on this particular point. There's a discussion of hospital mergers, which I'm not sure how and why that came up as an issue. I don't know if it was a point that the advocate was saying this is going to happen under the Affordable Care Act and it's going to reduce costs. That was not clear to me, so that's a little bit confusing. And then you do have the expert evidence that talks about prices. And again, if you're saying that there's going to be a 300 to 500% increase in the fees that, or excuse me, in the premiums that insured are going to have to pay, that's a pretty substantial increase. And but I wasn't quite clear that that's what that statistic said. That's one of the problems, because I think I'm getting a paraphrase or a summary of the evidence instead of a direct quote. If there is a direct quote that explains it, it needs to be there. And then there's this argument about facility fees, which I thought was an interesting point. Is this something that's been added because of the Affordable Care Act, or is this one of the reasons why costs have gone up? This has been going on, and that's what the Affordable Care Act is supposed to address. That was not clear. I assume from your point of view, you're saying that this is an add-on that people are putting in as a way of being able to increase their return in this situation. And like I said, to me, there's not a clear explanation in the evidence itself. So I think you've got some good evidence here on the arguments, but the evidence needs to be clarified a little bit. It needs to be more complete. You need to do more contrast with the arguments being presented by the advocate on those points. You did follow a structure that was clear, and I thought you did a good job presenting to the audience, despite your reservations that you told me about before. All right, thank you.